Two extended care employees spoke to CBC News on the condition of confidentiality. One says he wants to keep his job so that he can still help out amidst the devastation. And he says, quote, "It was a war zone. We were losing people every day. It was unimaginable, the conditions inside. They were so short-staffed. We would know that someone was dying, and we would find them dead on the rounds at 4 in the morning." The other employee says she was assigned to work in both areas that housed infected residents and wings where negative patients lived. And she says moving COVID-positive residents out of their rooms probably contributed to the quick and massive spread of the virus. A professor of epidemiology says it's best to keep infected patients where they are, but at Parkside, where many rooms house up to 4 people, that's easier said than done, he says.
You tend to get only one individual coming down with that illness first, and so then you're left with difficult choices around leaving that person where they're at because they may have already infected others in that room. But then if they haven't been infected yet, you're actually having people who are susceptible and vulnerable right next to that infectious person.
Health officials say many factors could be contributing to the outbreak at Parkside, including PPE use and ventilation. But Extended Care says it's had no concerns with its HVAC system and that it's well maintained. One worker says there weren't enough masks at Parkside until the outbreak began. Guy Quenneville, CBC News.